Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, if there are parietal lobe lesions, so what happens in parietal lobe lesions? In parietal lobe lesions, the clinical features of parietal lobe lesions differ from either it is unilateral parietal lobe lesion or dominant hemisphere or non-dominant hemisphere. First, if there is unilateral parietal lobe lesion, first the prominent feature, the common features for unilateral parietal lobe lesion. If there is unilateral parietal lobe lesion, parietal lobe is important for sensory loss. So whenever there is parietal lobe lesion, there is contralateral hemisensory loss is seen in the patient with astereognosis is seen in the patient. In astereognosis, the patient is not able to recognize the 3D shape of the patient by 3D shape of the object by touch. That is the uh, test of stereognosis is negative. That is astereognosis. That is, if you ask the patient to close his eyes and if you give a pen or some object in to the patient, then the patient has to recognize the object even when his eyes are closed. But if the patient is not able to recognize the object when the eyes are closed, then we call it as astereognosis, which is one of the feature of parietal lobe lesion. Then the patient can have agraphesthesia. In agraphesthesia, when you ask the patient to close the eyes and if you write some name or some letter or some number on the patient's hand, he should recognize the object while closing his eyes. But if he could not recognize the object by while closing his eyes, while if he could not recognize the letter or um, number by closing his eyes, then it is agraphesthesia, which is a feature of parietal lobe lesion. Then there can be contralateral homonymous hemianopia can also occur in the patient's homonymous lower quadrantanopia, mainly not hemianopia, it is quadrantanopia can occur in the patient. There can be asymmetry of kinetic nystagmus can be seen. This asymmetrical nystagmus may be seen in the patient with sensory seizures can be seen. So these are the defects in unilateral parietal lobe lesion. If that unilateral parietal lobe lesion involves the dominant hemisphere, if it involves the dominant hemisphere, then the patient will have dysphasia or aphasia, that is inability to talk. Then there can be dyscalculia. The patient finds difficult to do simple calculations. Dyslexia, where patient has difficulty in reading. There can be tactile agnosia, where the patient has very difficulty in identifying the objects on touch. There can be Gerstmann syndrome also. Gerstmann syndrome is presence of acalcria, agraphia, and finger agnosia, and difficulty to know right and left side together is called as Gerstmann syndrome. These are seen if there is defect is in dominant hemisphere of parietal lobe. But if the defect is in non-dominant hemisphere, then what happens? If the defect is in non-dominant hemisphere of parietal lobe, then there is spatial disorientation is seen. He is not oriented, and there will be constructional apraxia, where the patient is not able to follow simple instructions given by us. Then there can be dressing apraxia, where the patient could not dress himself. Like first he has to wear his innerwear, and then he should wear the shirt pant. So it's difficult for him to follow these rules. Like first he should wear innerwear, and then he should wear the shirt, and after wearing the shirt he should put his buttons, he should wear his pant, and after wearing his pant he should or trousers, he should zip it, and he should put the trousers, put the buttons. So all of this is a stepwise instructions. If he is not able to dress properly, then it is dressing apraxia. Then the patient can also have difficulty in identifying the object, which is anosognosia can be seen.
thank you and thank you for watching.